Imagine waking up tomorrow morning, swinging your legs out of bed like you have done 1,000 times before, and suddenly feeling the room spin. Your left arm goes numb, your words come out slurred, and within seconds, your entire life changes forever. This is what happened to a 72-year-old patient I treated, a man who had done everything right. He watched his diet. He took his medications. He walked every morning. But there was one thing he never thought twice about. He stopped drinking water after dinner because he was tired of getting up to use the bathroom at night. That single habit nearly cost him his life. What I am about to share with you today could be the most important health information you hear this year. Because what most people over 60 do not realize is that dehydration is not just about feeling thirsty. It is a silent, invisible process that thickens your blood, strains your heart, and dramatically increases your risk of stroke and heart attack, especially while you sleep. My name is Dr. David Miller. I have spent decades studying cardiovascular health in adults over 60. And today, I'm going to show you exactly how dehydration affects your body in ways you have never been told, the specific hours when you are most vulnerable, and a simple nighttime routine that could save your life. Before we go any further, I want you to drop a comment right now with just your age. That is it. Just your age. I want to see who is watching because this information applies differently depending on whether you are 60, 70, or 80. And if you have ever woken up with a headache, dry mouth, or feeling unusually tired, add the word morning to your comment. You will understand why in just a few minutes. Here is what most doctors never explain to their patients. Your body loses water constantly, even while you are sleeping. Through breathing alone, you lose nearly 2 cups of water every night. Add perspiration and the natural metabolic processes that occur during sleep, and by the time you wake up, your body has been running on depleting reserves for 7 or 8 hours straight. Now here is where it gets dangerous. When you are dehydrated, your blood becomes thicker. Research published in major medical journals has shown that even mild dehydration can significantly increase blood viscosity. Thicker blood flows more slowly through your arteries and veins. It forces your heart to work harder to push that sluggish blood through your circulatory system. And most critically, thicker blood is far more prone to forming clots. A large study analyzing over 3 million adults aged 80 and older found a strong association between dehydration and stroke. The researchers discovered that dehydrated individuals had significantly higher rates of all 3 types of stroke, including ischemic stroke caused by blood clots blocking brain arteries, transient ischemic attacks, and even intracerebral hemorrhage. That is not a small sample. That is 3 million people. But here is the part that should concern everyone watching this. The hours between midnight and 6 a.m. are when your cardiovascular system is most vulnerable. Studies have shown that between 6 a.m. and noon, your risk of heart attack is 40% higher than at other times of day. The risk of stroke is 49% higher, and the risk of cardiac death increases by 29%. Why? Because during sleep, several dangerous things happen simultaneously. Your heart rate slows, your blood pressure drops, the chemicals your body produces to break up clots are at their lowest levels, and if you went to bed even slightly dehydrated, your blood is already thicker than it should be. Now combine all of these factors. You have thick, sluggish blood moving slowly through arteries that are already stiff from decades of aging. You have a clotting system that is less active during the night. And you have a cardiovascular system that is under increased stress during those early morning hours. This is the perfect storm for a stroke or heart attack. Let me tell you about something that happens to the human body after age 60 that most people are completely unaware of. Your sensation of thirst actually decreases as you age. Medical research has confirmed that older adults have a higher osmotic operating point for thirst sensation. In simple terms, by the time you feel thirsty after 60, you are already significantly dehydrated. A study published in Medicine and Science in Sports and Exercise found that when older adults were deprived of fluids, they exhibited decreased thirst sensation and reduced fluid intake compared to younger adults. Their bodies were dehydrated, but their brains were not sending the proper signals to make them want to drink. This is critical information. You cannot rely on thirst to tell you when to drink water. After 60, thirst is a lagging indicator. By the time you feel it, the damage to your blood viscosity may already be happening. Now, let me explain exactly what happens inside your body when you become dehydrated. Your blood is composed of plasma, red blood cells, white blood cells, and platelets. When you are properly hydrated, the plasma volume remains optimal, allowing blood to flow smoothly through your vessels. But when you lose fluids, that plasma volume decreases. Your blood becomes more concentrated with cellular components. This increases viscosity, which is essentially the thickness and stickiness of your blood. Thicker blood creates a cascade of problems. First, it increases the workload on your heart. Your heart has to pump harder to move viscous blood through your arteries. Over time, this additional strain can contribute to elevated blood pressure and cardiovascular stress. Second, thicker blood flows more slowly. When blood moves sluggishly through your vessels, it is more prone to pooling and forming clots. These clots, called thrombi, can travel through your bloodstream and lodge in critical areas. If a clot blocks an artery supplying blood to your brain, you have a stroke. If it blocks a coronary artery, you have a heart attack. Third, slow-moving blood delivers less oxygen to your organs and tissues. Your brain, your heart, your kidneys, every organ in your body depends on adequate oxygen delivery. When that delivery is compromised, cellular function suffers. So what should you actually be drinking? The National Academy of Medicine recommends that men over 51 drink approximately 13 cups of fluid daily. For women in the same age range, the recommendation is about 9 cups. However, individual needs vary based on body weight, activity level, medications, and health conditions. A common guideline is to drink about half an ounce of water for every pound of body weight. If you weigh 160 pounds, that works out to 80 ounces or about 10 cups daily. But here is what matters most for preventing nighttime cardiovascular events. The timing of your fluid intake is just as important as the total amount. Many older adults make the mistake of dramatically reducing water intake after dinner to avoid nighttime bathroom trips. While this concern is understandable, the solution is not to stop drinking entirely. Instead, you need a strategic approach. Let me give you the nighttime routine I recommend to my patients. First, drink a glass of water about 1 to 2 hours before bedtime. This gives your body time to absorb the fluid while also allowing you to use the bathroom before lying down. Second, empty your bladder completely right before getting into bed. Third, keep a small glass of water on your nightstand. If you wake during the night, take a few small sips. This helps maintain hydration without requiring you to drink large amounts. Here is another critical point. If you are taking medications for blood pressure, heart conditions, or diabetes, many of these can increase your risk of dehydration. Diuretics, commonly prescribed for high blood pressure and heart failure, increase urine production and accelerate fluid loss. Certain diabetes medications have similar effects. If you are on any of these medications, you need to be even more vigilant about maintaining hydration. Now, let me share with you some warning signs that indicate you may be chronically dehydrated. Dark-colored urine is the most obvious sign. When you are well hydrated, your urine should be pale yellow, almost the color of lemonade. If it looks more like apple juice, you are already dehydrated. Other warning signs include persistent headaches, especially in the morning, fatigue that does not improve with rest, dry mouth or cracked lips, dizziness when standing up quickly, constipation, and decreased skin elasticity. If you pinch the skin on the back of your hand and it does not snap back immediately, that can be a sign of dehydration. Some people ask me whether other beverages count toward daily fluid intake. The answer is yes, but with important caveats. Coffee and tea do contribute to hydration despite containing caffeine. However, alcohol is dehydrating and should not be counted toward your daily intake. In fact, if you drink alcohol, especially in the evening, you need to compensate with additional water. Here is what I want you to remember. Every night when you go to sleep, your body enters a period of vulnerability. Your cardiovascular system shifts into a different mode. Your blood becomes more prone to clotting. And if you have not adequately hydrated throughout the day, you are entering those dangerous early morning hours at a disadvantage. The good news is that this is entirely preventable. Unlike many health conditions that require expensive treatments or complex interventions, proper hydration is simple, free, and completely within your control. Let me summarize the key action steps you should take starting tonight. First, monitor your hydration status by checking the color of your urine throughout the day. Aim for pale yellow. Second, drink fluids consistently throughout the day, rather than trying to consume large amounts all at once. Third, do not stop drinking water after dinner. Instead, have your last glass 1 to 2 hours before bed and empty your bladder before lying down. Fourth, keep water accessible at your bedside for small sips if you wake during the night. Fifth, if you take medications that increase urination, talk to your doctor about strategies to maintain adequate hydration. You now know something that most people your age do not understand. You know that dehydration is not just about feeling thirsty. You know that your blood thickens when you are dehydrated, increasing the risk of dangerous clots. You know that the early morning hours are the most vulnerable time for cardiovascular events, and you know that simple hydration strategies can dramatically reduce that risk. If this information was valuable to you, if it gave you clarity about something you had never considered, drop a comment saying, "Hydrated." Share this video with family members and friends over 60 who need to hear this message. Subscribe to this channel, because every week I share research-based health information specifically for adults over 60. In my next video, I'm going to show you the 3 morning habits that can dramatically reduce your risk of heart attack and the one thing millions of people do every morning that actually increases their danger. I will see you there. This video is for educational and informational purposes only and is not intended as medical advice. Hydration needs should be individualized based on your complete medical history, current health status, medications, and other factors. Never make changes to your fluid intake or medications without consulting your healthcare provider. Always work with a qualified healthcare professional before making changes to your health routine.